Hey, it's Eric Von Haessler. I'm not here today, but my favorite doctor, Dr. Joe, is going to sit in for a while. I think you should stick around because I think you're going to enjoy his medicine.
Everyone has an opinion, but he's got the Von Haessler doctrine. Eric Von Haessler on WSB.
Hey folks, Dr. Joe here. I know you're very sad that Eric's not here, but hopefully he's enjoying his day off because he is a extremely hardworking man. I love being on his show. And if you've heard the show before, I'm here with Anti-Dr. Joe, but Anti-Dr. Joe isn't even here today, Alan. I'm all by myself today. When Eric's here, he's got his whole room full of people. Today, me, you, and Ashley. So the A's and Dr. Joe are here today. Glad you could be here. I am just so excited to cover for my good friend Eric. And like I said, hope he's having a good time. So if you've never heard my show, I'm on Sunday evenings on WSB from 7 to 9. Hopefully you tune in all the time. And so when I got a call yesterday and they said, hey, can you step in and fill in for Eric? I said, absolutely. I was excited. So here I am. So I thought about what could I cover? Because usually my shows, I take one topic and do a 2-hour spread on it. But we only have an hour here, and I'm going to open up the lines to callers. So if you have a healthcare question, you give us a call, 404-872-0750 or 1-800-WSB-TALK. And so I thought, I'm just going to give you little health tips, things that you can do in a minute or less to get well. I did this as a show, and I got so many I didn't even cover. I'm going to cover the ones I didn't cover on my show. It was real popular because so many times people want to get well, and they don't know what to do. And they say, well, Dr. Joe, what can we do to get well? If you're the first time you're tuning in, I'm board certified in chiropractic, I'm board certified in orthopedics, I'm board certified in pain management, double board certified in nutrition, BS in nutrition, retired dietitian, award-winning author. My show on Sunday nights on WSB is the #1 health and wellness radio show in the world. We're syndicated all across the country. So I'm glad that we get to spend a little time together, get a new audience. So the #1 reason patients come see us, and we have offices in Marietta, Duluth, and Stockbridge, is they have pain. Neck pain, back pain, shoulder pain, car accident injuries. So we see that all day, every day. My doctors and I work real hard to get you guys out of pain. #1 reason people have pain is a pinched nerve. So the bones in your spine, you have 24 bones in your spine. If they move out of place, they pinch a nerve. When you pinch a nerve, it hurts. But here's the kicker. 90% of your nerves don't feel pain. Most people don't know that. You don't feel your blood pressure, but it's controlled by nerves. You don't feel your spleen, your kidneys, your thyroid, your earwax, all controlled by nerves. So when patients come in our offices, we want to deal with patient's pain, but we also check the nerves that don't feel pain. Because you have a pinched nerve going to your liver, your spleen, or your lungs, that might be the reason why you're just not getting better. And that's why I refer all the time to my medical colleagues. They refer back to us. A lot of major universities around here have me teaching postgraduate work because we want to get to the cause of your problem and not just treat the symptoms. So a couple of things you can do. If you have pinched nerve, if you have pain that lasts more than 3 days, you want to get it checked. Because every day patients come in our offices and they say, well, Dr. Joe, I've had this pain for fill in the blank, 2 years, 5 years, 10 years, 20 years. And I say, why didn't you do something about it sooner? I don't know. I didn't know what to do. Well, check to see if it's a pinched nerve. And if it is, well, of course, unpinch it. As far as supplements go, and I'm big into nutrition and supplements, many folks are deficient in magnesium. Most people are deficient in magnesium. You just don't eat enough foods with magnesium in it. So that's why if you soak in an Epsom salt bath, it might help because Epsom salt is magnesium. But be careful if you're taking magnesium supplements because too much magnesium makes your muscles relax. It can make your digestive system relax. That's why if you take milk of magnesia, well, it makes you go to the bathroom. So just be careful taking a magnesium supplement. Too much of it could be a problem. #2 reason I see patients, I've been in practice now for 33 years. #2 reason I see patients is they have digestive problems, acid reflux, heartburn, burping, gas, bloating. How many people have that? Raise your hands. A lot of you do. I know you do. Many times the problem is physical, not chemical. What the heck does that mean? You have a sheet of muscle called your diaphragm. Below your diaphragm sits your stomach. And food goes through a hole in your diaphragm called lower esophageal sphincter. It goes into your stomach, you digest it, you pass it on. Most of us, myself included, the stomach can push up into that sphincter. And that can cause acid reflux, heartburn, burping, gas, bloating. What we have to do in many cases is actually physically massage or adjust or pull the stomach down away from the diaphragm. And when we do that, now the food stays below the diaphragm. You don't have the acid reflux. Sometimes you'll be diagnosed with a hiatal hernia. But the kicker is this. If you have the acid reflux, this is going to blow your mind. Here we go. Your stomach's job is to take proteins and break them into amino acids. So it kind of breaks proteins down into minor components there. The amino acid tryptophan eventually becomes serotonin in your brain. Serotonin is the neurotransmitter that helps you focus, makes you happy. Serotonin becomes melatonin, which helps you sleep. So many folks with acid reflux have emotional issues. They're anxious, depressed, they can't focus, ADD, ADHD, and they can't sleep. So tracing it back, many times it's a physical problem, not a chemical problem. And I am not against you taking your medication. Please stay with your medication, follow your doctor's advice, absolutely. But just know that if you're taking a lot of these antacid medications, a lot of them prevent you from absorbing calcium, magnesium, B12, and iron. Well, there's a problem now too, isn't it? Calcium, magnesium, B12, and iron. B12, as a chiropractor, I worry about your B12 levels because B12 helps the nervous system, and that's my job, is make sure your nervous system is working. So we want to get to the cause of the problems, not just treat the symptoms. So the lines are lighting up, so let's start taking some callers. Paul, how can we make your day better?
I talked with you a couple of months ago about my shoulder, and I thought maybe I had a rotator cuff, but come to find out I have arthritis in both my shoulders, and I'm trying to find something to help me relieve the pain.
Sure.
The doc had me on a non-steroidal for a while, but he said it's really hard on the kidneys, and I'm wondering what I can do that's not going to burn up my kidneys.
Sure. Well, the reason we get osteoarthritis anywhere in the body is like we was talking about, a physical problem. If the bones are out of place, they rub up against each other. So the first thing for your shoulder is you want to get that shoulder put back in place because that should help tremendously. Then you got to stay away from the foods that cause inflammation. This is where you have control. I call them the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. I know all of Eric's listeners just went, but that's my whole diet, Dr. Joe. I know it is.
Exactly.
Everybody says it. Been doing this for a while, I know. So try to eat more in a plant world. Fruits, vegetables, nuts, seeds, at least one meal a day. Have a big salad. And you can throw vegetables in there. You can go avocados, nuts, seeds, because raw foods have something in it called enzymes. And enzymes, when they get into the body, can actually help break up inflammation. In fact, one of the supplements I have is Dr. Joe's Enzyme Support. And it's really popular because as we get older, we produce less enzymes. So what do we want to do? Increase our enzyme levels. And the enzymes are kind of like Pac-Man. They get in there and help fight inflammation. So Dr. Joe's Enzyme Support is one, and all this stuff is on my website, folks, drjoe.com, just DRJOE, drjoe.com. And this show, thousands of hours of other shows are on the website as well, videos, drjoe.com. But getting away from the inflammatory foods is going to help tremendously. Then you can also do turmeric. Turmeric is a great anti-inflammatory as well. But until you get that shoulder put back in place, chances are you're going to keep having problems with it.
Okay.
I know. Sound like a plan? All right, Paul.
The magic bullet. Always looking for the magic bullet.
Really? You're the only one, Paul. Everyone else understands it takes time to get well, but not you. No. Thanks, Paul. I appreciate the call. All right, let's keep taking some calls here. Let's see. Lynn, how can we make your day better?
Hi, my name is Gwendolyn Johnson, and I have an 84-year-old mother who fights in her sleep. She reacts to her dreams.
Okay.
Very physically.
Right.
And she got very physical because I chose to sleep with her while I was visiting.
Sure, I understand.
So I'm trying to figure out what can help her. She's only on 2 medications, one for high blood pressure and one for her heart.
Okay.
And aspirin and a multivitamin.
Okay, so the multivitamin
it feels dangerous.
Okay, absolutely stick with the multivitamin. You might want to consider something like melatonin to help her with the sleep. Okay, chamomile is also something. If she drinks tea, a chamomile tea would help. Melatonin might help. And if she has that acid reflux, like we were talking about, many times that prevents the body from going into the deep sleep. So if she has that acid reflux, check with her. Burping, gas, bloating, chronic cough, sinuses, all sinus problems, that all could be acid coming up into the throat. You might want to consider getting the stomach fixed, but then also try those supplements and see if that helps as well.
Okay. Thank you.
Thanks so much. I appreciate it. So, folks, I'm Dr. Joe Esposito, standing in for Eric Von Haessler. Hopefully he's taking the day off and resting because that man, he's a hard worker. And, you know, I hope he's not listening. He's going to get a fat head over this. He's so darn smart. I really enjoy being on his show because it's always fun. We have a segment called Sparring with Dr. Joe, he and I. And it's just a blast because he really can go toe-to-toe. And it's funny because over the years, he said, well, the time we've been together, he said, I wanted this to be an argument that you and I have every show. He says, but I find myself agreeing with you all the time. He says, and it's really annoying because I want to argue with you. So every now and then we have a little tiff, but not often. Now, the last caller talked about a multivitamin. That is so important. So let's talk about supplements for a second. In today's world, the food isn't the same food we had years ago. The soil is depleted. We're using a lot of chemicals and sprays that we didn't use 20, 30, 50 years ago. So taking supplements is huge. I'm a big supporter of supplements. I take Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. I have them sitting here in the studio with me. I mix it with coconut milk or almond milk, and I shake it up and drink it. And it's prebiotics, probiotics, digestive enzymes, a complete multivitamin. And I always tell my listeners, now you're my listeners too, by the way, if you're going to do nothing else, at least take Dr. Joe's Super Greens and Dr. Joe's Essential Source. Relatively inexpensive. They taste great. And once you take it for a couple of days, you start to see the difference. It's not going to happen in one day, but give it a few days. Those are on my website, drjoe.com. But most people are deficient in nutrition, and most people aren't willing to do what it takes. Folks, got to go to break. I'm Dr. Joe Esposito, standing in for Eric Von Haessler. If you have a healthcare question, 404-872-0750, 1-800-WSB-TALK. Hey, tell your friends about the show. We'll be right back. Hey folks, Dr. Joe here. Hope everybody's having a wonderful day. I'm standing in for Eric Von Haessler. Hopefully he is taking a little time off. Crimson and Clover. Now, why did you pick that, Alan? I love that song. Total rant. I love that song, man. I'm an old rocker. I used to work in a jukebox company. I used to fill jukeboxes. And I don't know. Tommy James Shondells, that's it, yes. But I used to take 45 records and send them out to the event. I was like 13 years old, and that was my job. So I knew I could picture the 45 when you played the record, though. So good. This is nice. I like this. On my show, I can't talk about bumper music because my shows were syndicated, so nobody hears the bumper music. But here I can. Anyway, glad you could be here, folks. I'm Dr. Joe, standing in, because Eric sits down. I'm standing in for Eric Von Haessler today. And we're talking about tips that you can do, things that you can do in 60 seconds or less to get healthy. Now, one thing you might want to consider, being lunchtime's coming up, is stay away from fruit juices and sodas and sugar. Because when you put sugar in your body, I can give you a 4-hour lecture on sugar, but sugar really is evil. And if you're drinking fruit juices, you're drinking fructose. More fructose. It has some glucose in it and fructose. Now, let's take white table sugar. Half fructose, half glucose. When you put it in your body, the fructose has to convert into glucose. And in the process, it creates uric acid. Now, uric acid gets in your joints, and it hurts. Now, as a chiropractor, my team of doctors and our job is to get you out of pain. And if you're doing a lot of fructose, you're creating uric acid. Uric acid gets in your joints, and it hurts. And you're kind of fighting us. We're giving you chiropractic care. We're fixing the spine. All 206 bones in the body we can adjust. But you're kind of counteracting what we're trying to do. But that's not the worst part about fructose. Uric acid gets into joints and it hurts. Uric acid prevents you from producing something called nitric oxide. Nitric oxide opens up your blood vessels. It's nature's little blue pill. So if you don't have enough nitric oxide, you can't get good circulation. Now, I've been in practice now 33 years. And years ago, when men had issues, romantic issues, family show, I know we're prime time here, usually it was older men on blood pressure medication. Now I'm seeing guys in their 20s coming in with these problems. And a lot of it has to do with circulatory issues. They're just not getting enough nitric oxide, and the reason is they're not producing it because they're taking in too much fructose. Now, you can take a nitric oxide supplement. I have a supplement called Dr. Joe's Nitric Oxide Support, and it opens up your blood vessels, and it works great. And it also helps your brain. But the new research now is showing that Alzheimer's, we're leaning more toward thinking it's a circulatory issue, because the arteries get clogged up and you can't get oxygen to the brain and the brain starts to malfunction. So the good news is if we can reverse that, and a lot of times we can with a good diet, a lot of raw foods in the diet, enzymes, the arteries can clean themselves out, which is the good news, and you get circulation back. But you got to stay away from that fructose, folks, and high fructose corn syrup, because it's just causing so many health problems. and if there was one thing I could get you to do is give up, would be artificial sweetener and fructose. Those are the two I really want you to consider getting out. But if you like fruit juice, have yourself a piece of fruit. Instead of having apple juice, have an apple. There's a novel idea. Because what happens is when you chew, there was a study in the International Journal of Obesity, which I'm sure you have that journal at your house right now, probably in the bathroom, you read it all the time. They showed that people reduced their daily caloric intake by up to 20% when they substituted a piece of fruit for fruit juice, just one meal a day. And the other thing an apple does, too, is it helps clean your teeth, because when you chew it, it cleans your teeth out. And a lot of times, people have bad breath. And one of the reasons is they may not be brushing like they should, but if you do something like chewing an apple, that's going to help break that down as well. Now, if you're going to eat apples, I'm going to recommend you do organic, because a lot of times apples are sprayed with pesticides, and then they're dipped in wax, and they make them all pretty. Well, those pesticides can cause some real serious health issues. So to be on the safe side, if you're going to eat the skin of a fruit, I'm going to recommend organic only. Now, if you can eat a banana, watermelon, avocado, I'll cut you a little slack on that. But do this. Wash the fruit, because there can be chemicals and toxins and cooties on the outside, and when you slice into it, you're driving those things into the food. So that's what my show's all about. I'm on Sunday nights from 7 to 9 on WSB, is I try to give you things that you can do to take care of yourself, because I want you to get well. We're in a scary time right now, folks, with healthcare. I'm telling you, all my doctor friends, medical, chiropractic, neurosurgeons, vascular surgeons, we all get together, and we used to joke, we talk about girls in sports. And now we talk about, what's your exit strategy? What's your retirement plan? Because it's becoming really difficult to practice healthcare anymore. And so we're in the middle of a healthcare crisis, and that crisis is a doctor shortage. And it's going to get worse, I promise you. Enrollment is down in medical schools, enrollment down in chiropractic schools, and that's going to be scary when you, the patient, doesn't have a doctor to go to. And doctors are graduating now with $200,000, $300,000 in debt, and there's no jobs. So you got to learn how to take care of yourself. Folks, if you go to my website, drjoe.com, we just got that website, drjoe.com. We have hundreds of hours of archive radio shows. If you want to listen to podcasts, go to your podcast source. It's For the Health of It is the name of my podcast. We have offices in Marietta, Duluth, and Stockbridge. If you have any questions I can't get you on the air, send me a question through the website, drjoe.com. Hey, folks, if you're on hold, keep holding. We're going to be right back.
Hey, it's Eric Von Haessler. I'm not here today, but my favorite doctor, Dr. Joe, is going to sit in for a while. I think you should stick around, because I think you're going to enjoy his medicine.
Hey, folks, I am the aforementioned Dr. Joe, standing in, because Eric sits. I'm standing in for Eric. Just got a text from Jared, the producer, saying he's sounding good. So thank you, Jared. I'm glad I got your approval there. I get worried. I don't want to tick off the regular crew here, you know. My show's on Sunday evenings from 7 to 9 on WSB. If you've never heard it, you should. You can go to my website, drjoe.com, and we have hundreds, well over 1,000 hours of archive radio shows, podcasts, videos of live lectures that I do. We're going to start videotaping Sunday morning. I do Sunday morning on B98 and 97.1 The River, and we're going to start videotaping that next week. I just found out from Shaney, and we're going to have that available as well, so that's kind of fun too. But if you're serious about wanting to get well, that's my job. My job is to teach you how to naturally get well and stay well, and things that you can do every day to obtain and maintain good health, because it's a scary time. You know, I'm not a political guy, but politically it's a scary time when it comes to health care. Insurance companies are paying less and less. Doctors are dropping out of care. Alan and I were just talking. A doctor spends about 7 minutes with you. When you walk in the room, you got to get in and out in 7 minutes, because we're out the door. Because we just don't have the time. The insurance companies are not allowing us to do what needs to be done, because they're dictating your treatment plan. So you need to take control of your own health. And that's why the shows and the podcast, if you go to your podcast sources, iTunes, Google Play, it's For the Health of It is my podcast. And then you could binge listen if you want to as well. And I also have them on YouTube channel as well. So it's plenty of ways to get the information. But it's a scary time. I'm scared. I'm a patient too, don't forget. And I'm scared too, because I don't know what's going to happen. Doctors aren't having fun anymore. They're thinking about, what can we do to get out of this mess? And so you, the patient, are going to suffer. So that's why I want to make all this information available to you. And by the way, if I don't get you on the air today, and we've got a lot of callers, if I can't get you on the air today, send me a question through the website, drjoe.com. I'm more than happy to answer your questions. So let's take a caller right now. Samantha, how can we make your day better?
Hi. So my husband has had lower back pain for a long time. He's a mechanic, so it kind of comes with the territory.
Yeah.
But I finally got him to go and get an adjustment. And, the first one was fine. Second one, he was like, man, I feel like I've just did a full body workout for 3 hours. And the next day, he had no strength in his hands.
Mm-hmm.
And so called the chiropractor, and they were like, well, we don't know. So he canceled his next appointment. And at this point, I just want to know what I can give him to help kind of regenerate his body, to make those muscles kind of stronger faster so that he can work again.
Right. Now, I would say there's 3 things you have to get healthy: a normally functioning nervous system, a normally functioning digestive system, and good nutrition. So nutrition is going to be a key for anyone. Doesn't matter if you're a chiropractic patient or not. So you got to make sure you're eating the right food. So a lot of fruits, vegetables, nuts, and seeds. Of course, I recommend Dr. Joe's Super Greens, Dr. Joe's Essential Source. If there's an energy issue, there's an adrenal supplement that we have. So taking that is great. But I'm a little concerned that it's only been 3 treatments, because if I went to the gym 3 times, I'm not going to see muscles. So
he wanted to continue going, but the chiropractor's response was, well, that couldn't possibly have been from the adjustment. And he was like, I don't really like that attitude. And so didn't go back, which is understandable. Sure. I'd like for him to find another chiropractor, but I don't really think that's going to happen now.
Yeah, well, I agree with you. I mean, anything can happen from an adjustment. I've had people that were crippled walk, and I've had people that couldn't see, take their glasses off. But I've also had people like your husband who don't respond in a short period of time. So again, the attitude might have been an issue, but that doesn't mean I'm sure people have gone on dates and didn't marry the first person they dated. Doesn't mean they give up on dating, or you had a bad meal. You don't give up on eating. So chiropractic usually works. The chiropractor may not work, just like with medicine, just like with surgery, just like with physical therapy. So you might want to have him consider checking out, if he doesn't want to go back there, somewhere. And, we're not far from you. Our main office is in Marietta. We'd be more than happy to take a look at them for you.
Excellent.
Okay?
Thank you so much.
Thanks so much for the call. I appreciate it, Sam. All right. Let's see. Let's go to Amber. How can we make your day better?
Hi there. Well, I have a son who is 10 years old.
Yes.
And he has had stomach problems since he was 4. And the doctors eventually said he had celiac, so we completely changed his diet.
Good.
But nothing has helped. He has chronic pain. He has diarrhea almost daily. Mm-hmm. He always goes to the bathroom following meals.
Okay. Go to my website, and under articles, I think it's the 5th or 6th one down, you're going to see, I think it's under blog, actually. You'll see an article I wrote on GERD, gastroesophageal reflux disease. Read that over.
He was diagnosed with that when he was a baby.
I'm psychic. See that? I know your son, Amber. Oh. No, and this is I'd say 80% of the patients that I test have some type of GERD or acid reflux or digestive issues. And many times, as we said earlier, it's a physical problem. Just like chiropractic is a physical issue. You put the bones back in place. We can relax or massage the stomach down away from the diaphragm. And a lot of times when I see patients like your son, they have focusing issues. They'll have, okay, see how psychic I am? Because the stomach isn't breaking proteins into amino acids to produce neurotransmitters that make the brain work. So we see, I saw 6 new patients yesterday that had digestive problems. That was yesterday. And I have 4 other doctors in my office. So it's a really, really common issue. And you might want to consider, if you want to bring them in, I'm more than happy to take a look at them. And if it is that, you'll probably say, wow, why didn't I do this sooner? Which is what most people say. So the medicine is, and again, I support the celiac approach. Stay away from wheat. Stay away from wheat, barley, and rye. They have gluten in it that can irritate the bowels. But there might be a physical problem that you're missing.
Okay.
Okay?
Okay.
Thanks, Amber. Appreciate the call. All right. Let's see here. Oh, can't see your name here. Oh, hello. I hear beeping. Yeah, hey, Dr. Joe here. Who's this?
This is Robert.
Hey, Robert. How can we make your day better?
Yeah, I've been on pain management for about 6 years.
Uh-huh.
And I'm taking 2 different pain medications, and because of my work, one of them I'm having to come off of.
Right.
And I've just started, like 4 days ago, coming off of the one. But I'm trying to find out what I could do or what I could take to alleviate. I'm having a lot of, like, joint pain.
Sure. Okay.
From coming off of the medication.
Well, of course, yeah. And again, I'm not against medication. Please understand that. But sometimes coming off it becomes an issue. So couple of things. Got to stay away from those inflammatory foods, sugar being a big one. Dairy products are very inflammatory as well. Even animal products all animal products can be inflammatory. So switching over, if it's a chiropractic issue, you might want to get your spine checked. Of course, as a chiropractor, I have to say that. But alkalizing your system is going to be the key, because when the body is acidic, that's when it starts to have problems. So here's a little trick you can do, Robert. Go to a drugstore and get some pH paper, it's called. Okay? And tomorrow morning, first time you pee a little bit, and then pee on the pH paper. And Alan's nodding his head in agreement there. And you want to be about 6.5 to 7.0. Now, you'll see a color chart, and this will all make sense to you when you see the pH paper. Right. And if you're closer to 6.5 or lower, your body's very acidic. And that just irritates the heck out of the joints and really causes your pain level to go through the ceiling. So if that's the case, we want to alkalize the system. And you do that with a lot of green food, salads, Dr. Joe's Super Greens, Dr. Joe's Essential Source, so loaded with minerals to alkalize the system. So from a nutritional standpoint, that's what I'd recommend. But you also want to check the physical. If there's something physical, you want to get that checked too.
Right.
Okay?
Okay, great.
Give that a shot, Robert. Let me know how it works. Folks, I am Dr. Joe Esposito. I am standing in for Eric Von Haessler because hopefully he's not listening, because I may ruin the show. No, I'm not ruining the show for you, Eric. But I want him to rest. The guy's really a hardworking guy, and we talk a lot because he's a good friend of mine. And he says, he goes home, he thinks about the next show. He wakes up in the middle of the night, thinks about the show. So it's good. He needs a little downtime. So today we'll give you a little health tips on how to get well and stay well. We're also taking callers. So let's just keep taking callers at 404-872-0750. And if I can't get you, folks, and there's a lot of callers, send me the question through my website, drjoe.com. Keith, tell me what's going on in your world. Hello, Keith. Earth to Keith. Come in, Keith.
Can you hear me?
I can hear you. Go ahead, yes.
Anyhow, I've been having back pain since about 2012. I got in a car accident. I was a passenger in the car, didn't have my seatbelt on, being dumb. I hit a tree running about 55, messed my back up pretty bad. After I got out of the hospital and all, got better, I started going to a chiropractor 3 times a week. And I started going to a massage therapist once a week.
Good. Okay, hurry up.
But I'm a heavy equipment operator.
Oh, yeah.
So I ride in an off-road dump truck all day, so I'm bouncing around up and down all day. And my back constantly gives me troubles. And I eat ibuprofen and goody powders like they're going on a stall.
Yeah.
And I know that's not too good. That's not good for me.
Right.
I was wondering if there's something, because I'm trying to get myself better. I ain't trying to kill myself.
Yeah.
So I was wondering if there's something else that maybe I could buy offline or something else that I could try to ease my back pain. Or
Sure. Well, what you want to do is at the end of the day, you want to use ice, not heat. 20 minutes on, 20 minutes off. Heat will increase the circulation, which can increase the inflammation.
Okay, because see, I've been using a little heat pad.
There you go. All right, so ice, not heat, 20 minutes on, 20 minutes off. And this is going to sound like a weird question. Any constipation?
Yes, sir.
Okay.
Sometimes.
Yeah, because the constipation, the bowels can get...
I've got stomach problems, too.
Yeah. Well, there you go. So we got to try to work on that. So there's one supplement I have. It's called Dr. Joe's Intestinal Cleanser. It's on my website, drjoe.com. You might want to try that. And once the bowels start moving, that takes a lot of stress off the low back. And then also, like we said the other caller, you might want to try another chiropractor to see if we can get that problem fixed, get to the cause of the problem, not just treat the symptoms. Let's try getting those bowels working. Let's see if that helps.
And what did you say that was called?
It's called Dr. Joe's Intestinal Cleanser. It's on the website, drjoe.com. If you have an Amazon account, we're also on Amazon as well.
Okay.
Alan's saying it works. I've given it to Alan, and it does work, yes. So if you have an Amazon account, it has all my books, my supplements. It's all there, too. Okay? Thanks, Keith. Appreciate it. All right, folks. Yeah, and again, I have books, 2 books written. Eating Right for the Health of It is my first book, and then A Prescription for Extreme Health is also on my website, also on Amazon, too. And you want to listen to my podcast? I know Shani is the one who runs my podcast, Shani B. So just go to Google Play or iTunes or Stitcher, and it's called For the Health of It. And you can binge listen to my Dr. Joe shows. And I'm on 7 to 9 on Sunday nights on WSB. So if you want to catch my show there, you can. Hey, listen, got to go to a break, folks. Again, my website is drjoeesposito.com. The callers that are on hold, I'll try to get to you. We won't be able to fit any more in today. But I am standing in for Eric Von Haessler, who I hope is having a day off. And we want to get you well and keep you well. That's what I love about working at WSB. Our goal really is to give the listeners what they want. Give them information that they can use every single day. And that's why WSB, we're number 1. Folks, I'm Dr. Joe. My website, drjoe.com. Hey, tell your friends about the show. I'll be right back. Hey, folks, Dr. Joe here. Dr. Joe Esposito, in case you don't know who I am. I'm standing in for Eric Von Haessler today. I do a show on Sunday nights from 7 to 9 on WSB and Sunday mornings on sister stations, B98 and The River. I just got a text from my staff member saying, slow down. We can't understand what you're saying. Alan, why didn't you tell me to slow down? What's wrong with you? Okay, good. So the reason... I talk fast. I got a lot to tell you. But all these shows are going to be archived on my website, drjoe.com, also available on Stitcher, iTunes, and Google Play. The name of my podcast is For the Health of It, so you can catch a lot of my shows there as well. But Abby, you're absolutely right. I do need to slow down. But I just get excited. I'm in for Eric. Gosh, I mean, what an honor to stand in for the great Eric Von Haessler. Wow. Forgot to mention this. Last caller had mentioned he was in a car accident. Folks, if you're ever in a car accident, if the car was damaged, you were damaged. 100% of the time. I've never seen a car accident ever where the occupants weren't damaged if the cars were. Now, sometimes you may get some pushback saying, oh, well, the car only had a little bit of damage. You weren't hurt. Well, your body is not as tough as steel. So that's why it's important. As soon as you get in a car accident, you come see us or go somewhere and get it checked. We have offices in Marietta, Duluth, and Stockbridge. But the longer you wait, the more the insurance company is going to play little games with you and say, okay, it's been, a few weeks, and so how do we know you were really hurt in the accident? So get in to see us right away. And a lot of times there's scam offices out there, healthcare providers, quote, that are really just going to run up the bill and not treat you. Make sure you're getting the treatment that you need. This is your life. This is not something that's a game. It's about you getting well, because if there's problems now, chances are it's going to become permanent in the future. Nick, how can we make your day better? Hello, Nick.
All right, you can help me with my hands.
Okay, tell me about him. Carpal tunnel?
Yeah, I'm assuming that's what it is.
Okay. Okay, a lot of... Okay, yeah, we're
go ahead.
A little tight on time, so let me jump right into it. Many times carpal tunnel syndrome, we always think it's the wrist, and we're going to treat the wrist, and a lot of times you may have treatment, surgeries, and you don't get the results you want, because oftentimes carpal tunnel comes from the neck. The median nerve, the nerve that runs down the middle of your arm there, is based in your neck. It starts there. So many times if you're treating the wrist and you're not getting the results you want, you might want to get the neck checked to see if that's where it's coming from. So that may be the reason you're not getting well. Okay?
All right.
All right, Nick, try that. Let me know how it works out. Okay. And sometimes, folks, it could be a circulatory issue as well. So if you have circulatory issues, cold hands, cold feet, you can try swinging your arms in a circular motion to try to get blood down there. But if you don't get those results, check the neck, and then you might want to consider taking a nitric oxide support, which is going to open up the blood vessels. Hey, listen, if you like what you heard today, unfortunately, we're running out of time. Follow me on Facebook, follow me on Instagram, sign up for my newsletter. It's on the website, drjoe.com. We send out a lot of good stuff. Sometimes we do live lectures, and you may have to pay to get in some of them, but many times we send out tickets to our people on our newsletter. So you want to stay in touch to get well and stay well. But follow me on Facebook and Instagram is a great way. But the newsletter is going to be another thing as well, because we want to get you well and keep you well. That's our goal. Let's see. Oh, man, I was going to take another caller, Alan. How dare you? I got 1 minute. Okay, so I got to dance around for 1 minute. All right, one more tip before we go off. Many people sleep on a bad pillow, and I see this all day. Patients come in our offices and say, Dr. Joe, my neck hurts, my back hurts after I wake up. Do this with your pillow. Fold it in half and then let go of it. If it springs back, you're in good shape. If it doesn't spring back, then we're going to have a problem, and that means your pillow's worn out. And when was the last time you bought a new pillow? A lot of people keep those pillows forever. So that's just another fun tip for you there. But once again, I'm Dr. Joe Esposito, standing in for Eric Von Haessler. My website, drjoe.com. If you want to get my supplements, Super Greens, Essential Source, Nitric Oxide, Adrenal Support. I've been in practice 33 years, so I know what most of you need. And I found that I fill the need by doing that, by having the supplements available. And if I didn't get you today, if you have questions, please send me your questions through my website. I am more than happy personally to answer your questions. And if you want to come see us as a patient, we accept people with insurances, no insurances, car accidents, sports injuries. Just go to my website, drjoe.com. And again, we have offices in Marietta, Duluth, and Stockbridge. And once again, folks, I really appreciate you listening to me. I know Eric wasn't here today. He'll be back next week. Hey, tell your friends about the show. Catch you next time.